Can people hear me? Thumbs up. Wait, thanks, Amanda. Thanks, Josh.
So I have got the stream running and I can hit the recorder. So if you want to start, we can do that. I got the roll call off the participant list, so that's good. So Julia, if you're ready, I'll hit the recorder.
I'm ready.
All right, we are recording. Go for it.
Okay. So I'll call to order the City of Edina Community Health Commission meeting on Monday, December 14th, 2020. This is a virtual meeting. And Jeff already took roll. I apologize if you can hear my children in the background tonight. Sorry about that. And so we already did roll call, so we'll take a look at the meeting agenda to approve.
I move to approve.
Second.
Anybody opposed? Okay, then it is approved. And now we'll go to look at our previous meeting minutes from November 9th of 2020.
I move to approve the meeting minutes. This is Tracy.
Andrew, second.
Anybody opposed? And they are approved. Now, Jeff, did you have any community comment at all to bring up? Nope. Okay. So we'll just move right on into the reports and recommendations. We have some subcommittee updates. If subcommittee 1 is Philip on, we met last week. Philip, I don't know if you want to give an update since you were
because
it was kind of your thing.
Kind of my thing. Okay. Yeah. Was it? Gee, that's news. No, just kidding. Yeah. No. We did meet last Monday, and we talked about a script that I put together to call other local governments, municipalities, to talk with their police about how the Vitals app is working in their community. And to my recollection, that we read through it, made a few recommendations, and it is approved to begin to be used. Am I right about that?
Yeah.
Okay. Yep. And so at this point in time, I am planning that probably after the holidays are done, might be a good time to start making calls. I'd like to let everybody get past the holiday season, and with all the health concerns right now, I don't want to get past at least the holidays before I begin calling. So, am I forgetting anything that anything in what I said?
No, nope,
Okay.
that's it. And I think the only other update from subcommittee 1 is that we're continuing to look into various reports about social connectedness, specifically throughout the pandemic era we live in.
Right.
Okay. And subcommittee 2 or 3, any updates there?
Subcommittee 3, I finally found the right button on my iPad here. It had one telephone conference where we agreed to each go off and try to search the literature for successful, documented with results, local approaches to the opioid epidemic, and including the prevention and then response. I was working with who's our student, Ava, on the prevention, particularly in adolescence. And while I found some literature, I must say, at least my search has been pretty unsatisfying so far. And Amanda sent me an email which suggests that she's not doing great either. So I think the plan is we probably should regroup, and it may just be a matter of sorting through and trying to find anything that people have claimed to work to bring forward for discussion. But local initiatives for opioid addiction are poorly documented, at least in terms of outcomes.
So, Greg, did you find that it was people tried or organizations tried and attempted things, but did not have much data to follow through with if it worked?
Yeah, I think it's easy to find descriptions of local programs, but I haven't been too successful. There is one paper that I came across that had some results, but really outcome data seems to be missing. It's more a collection of descriptions of programs that are available in various localities, but without much flesh on the bone. Most of the literature that I'm coming across about programs tend to be state and national programs that are far beyond the scope of what a city like Edina would be able to manage. Amanda, do you have anything to add to that? Or Andrew? Andrew is the other member.
One thing I just sent out to the group, like in response to this question Amanda had asked, I saw recently, I believe this month, an Oklahoma School District entered into an agreement on like kind of screening and prevention of this opioid and substance abuse in the Oklahoma schools with the Hazleton Betty Ford Center, which would seem fairly relevant. Obviously they just entered into it, so there's not going to be substantive data for a while. But knowing that, I think it'd be interesting if we were able to get somebody to from Oklahoma to kind of speak to the background on this. I'm sure, there had to have been data that led to this, decision being made. So I'm curious. It seems very relevant. It's kind of, a very, a more specific, policy on this topic as opposed to just, overall treatment. It's obviously focused specifically on, adolescents and, school environment, and also happening during this kind of, unique time in education where we have a lot of people remote. So I'm not sure if that factored in, but I feel like it's something that's worth exploring.
Sounds good. Any comments from Ava?
Sorry, I just got in. My computer was not working, so I'm not totally sure the topic, but I think if you were just talking about the articles you sent, I was just reading over them about 10 minutes ago and looking into that also.
Okay. So I suspect we may not solve the opioid epidemic problem, but we'll keep working on what we can do.
Anything from work group 2 that they'd like to say? If not, that's okay.
Yeah, no, we met, this is Tracy. We met, it's Michael, Andrew, Isa, and myself. We've met a couple of times. We have some questions that Michael kind of summarized and sent to Jeff. It's more of the lay of the land in terms of what's going on in here in Edina. By the way, work group 2 is working on smoking in public. Well, that's part of our thing is what's our kind of our scope. So is it just apartments? Is it condos? That kind of thing. So that's part of what we're looking at. We're curious because none of us know. Does Edina actually have any quote unquote public housing? I mean, any housing that Edina manages? Or
No.
yeah, okay, that's kind of what we thought, but we weren't sure. And then Michael had a great idea. He's got some friends that are developers and also that are on boards of different units. So we're going to kind of start doing some interviewing of those folks and figuring out, you know, what do they think about this? How potentially could it work? So we've kind of started scratching the surface on a lot of questions and ways to tackle the questions. I don't know if anybody else in the group wants to kind of pipe in, but.
Beautifully said, Tracy.
Thank you. We did have a question, Jeff, too, and I think, I don't know if you saw the email yet or not, but if who we could talk to, because we thought if we are interested in going down some kind of a path of trying to influence what's being done, we might have to do it through financing, through TIF financing or something like that. And if we could talk to somebody that could help us understand how that all works, that's another place we want to kind of go, which sounds a little overwhelming to me, quite honestly. The little bit I know about it, but it'll be interesting, I'm sure.
Yeah, I do not know a lot about how TIF financing works either. So I would have to talk to either like planning or economic development, someone, and get some nuts and bolts on how that works.
Yeah, and if you could just give us a name too, we're happy to do that. It's just kind of connecting us with the right folks. So that's really what we're looking for, is some connections, I think.
Okay. Anything else on any of the subcommittees? Otherwise, we can move to any chair or member comment. Okay, sorry, I've been told to leave 7 seconds of silence, so I'm trying really hard to do that. So any member comments? I have no comments.
I have something to say that is
Okay.
amazing news. From some business planning folks through vocational rehabilitation services. And I've been working with some on creation of a business plan to arrange for a grant so that I can start up my podcast business. And as of last Tuesday, that was all approved. So that means that the 2-3 weeks, somebody another person to begin using the grant to get and start getting everything registered with the state. And so with everything going as it is, if all continues to move as it is, up and running in January. So this has been an exciting project for me, one I never thought I would ever do. So I'll just say that my first two podcasts, one is going to be my introduction podcast and how I'm going to do it. Why am I doing it? What are my goals? A little bit about the things I do. One that's coming up after that is a really great one about autistic adults and the effects of COVID-19. It's an interview I did with Olivia James. She works in the Office of Communications and Marketing at the Autistic Society of Minnesota. She will be joining me for that conversation, and then things will move from there. Podcasts will be released twice a month, and so I've already got at least 4 filled with subjects and people to work with. So very exciting, and it's an opportunity to do some community autism awareness and education around autistic adults. And my real hope of it is to try to get some conversations going outside of the usual sphere, in the public going about autistic adults and the various things we do. That's my news, and I'll keep everybody posted. Along with the grant money, I'm going to be putting together a website, so that information will be coming out soon. So that's my big thing to say. So that's it.
That's great. Thanks for letting us know.
Congratulations, Philip.
That's awesome. Anything else from anybody? Any other members? I have nothing. Nope. Okay. Jeff.
Well,
Jeff comment.
as you can imagine, lots of vaccine discussion, kind of planning going on with Bloomington Public Health and how the cities are going to work with receipt of vaccines and distribution of vaccines, among staff, first responders, things like that. So don't anticipate that that's imminent, but I guess in the near future, maybe those mean the same thing. Otherwise, you may have heard that there is a large group of food establishments that plan to open this week in defiance of the executive orders. So it's been an interesting discussion around the city offices today and with some colleagues around the state about what do we do as local health departments that license these businesses in response, if anything. So we're talking about it. It's not an easy situation because it's just not like anything with COVID. So not sure how that's going to go. It'll be really interesting because I guess it's a 2-phased approach. Rural areas on Wednesday, urban or metro areas on Friday is what the businesses have stated. So our counterparts, our colleagues in more rural area health departments will get to experience it first and then the metro area after. So I don't know if we'll have any locally. We'll just see. So not a great situation to put local health departments in a tough spot, and obviously the businesses are in a tough spot. But we don't, we try to work with businesses and be an asset and be of assistance when they have kind of a problem, whether it's foodborne illness or something like that. It's not a great situation to be in a position where you're gonna be going in there to tell them they got to close or something. So we'll see where that goes. Otherwise, I don't really have any updates unless people have questions. Quick meeting then.
I guess I'll just make a comment that we'll know more on Wednesday, right? Well, Walt's supposed to announce everything or what the next steps are on Wednesday. So it's planning for the unknown. Lucky you. Anything else? Any questions?
Is the Community Health Commission in any kind of position to make any statements about such things? I mean, just to put something out there like we do or we do not. I mean, I'm just asking the question. Do we have the power to do something in a situation like this? At least make a statement about our position on something like that.
I think this one is pretty touchy, I guess. Pretty. I would not recommend any kind of addressing this situation. It's a really it's volatile, I guess, if you want to call it that. There's just a lot of intensity on all sides of it. Understandably, these are people's livelihoods. So I would say no. I guess I wouldn't say it's. I would recommend not doing it. The commission can always do some kind of statement or guidance. Maybe not guidance, but you can make. I guess I don't know the right word. Not a proclamation. You can put out something if you want to on a topic, but I would recommend against it on this one because I don't even know what the city's position is fully going to be at this point.
Yeah, I would like to just avoid it.
Yep.
At least in this work group, I would like to avoid it.
Yeah.
Yeah.
Well, and until we hear what the governor has to say, it would be futile at this point anyway.
Right. And honestly, by the time you get out something, if you get out a statement and whatever, we could be on to the next phase or 2 phases down the road. So I think there is like a timeliness factor too, that it's really difficult to get out there.
Just a question. It was just a question I thought I'd post.
Yep.
This is a huge public matter, because it's risking people's health and safety in many cases. But okay.
Well, it's a great question. It's a great question. Any other questions, comments, concerns?
Like many great questions, it doesn't have a great answer. That's why they are great questions.
Yeah, this is a difficult situation, that's for sure. Well, is this going to be a really quick meeting? Do we have anything else?
I move to adjourn.
Awesome. Do we have a second?
Second.
All right. So it shall be. We are adjourned. Now our next meeting is, I just like to do this at the end of meetings. Monday, January 11th, correct, Jeff?
Yes.
All right.
Everybody have
Same
a good
place.
holiday break or whatever you're going to do.
Have a happy
You
holiday.
too. Happy holiday.
Okay.
Take care.
Happy holiday.
holidays.
Yeah.
Good luck with the podcast.
Yeah.
Thank
good
you.
job, Philip.
Can you send out a link when it's up?
I sure can. And I sure
Awesome.
will.
Perfect.
Thank you. Have a good one.
Thank you.
Yep. Bye.